Thank you so much, Claire, for that wonderful, wonderful talk. And now I'm joined by the Mr. Rahul Kotwal, who is specializing in the knee. He's a consultant orthopedic surgeon in Bridgend, and he has got some questions. So over to you, Rahul.
Thank you, Yogesh. Absolutely fascinating talk, Claire. I have one question for you from the studio. Before I ask you this question, I would like to personally thank you for giving us these superb tips and tricks for managing anterior knee pain. They've helped me and they've also helped my patients, so thank you so much. So one question from the studio, it's about crepitus in patellofemoral pathology. As you said in your talk, that there is no relationship between crepitus with pain and function. In my practice, I often see that patients with minimal radiological arthritic changes, in fact, have a lot more crepitus than patients with severe arthritis of the patellofemoral joint. Is that what you observe as well? And what do you think is the reason for that?
Yes, we can actually look to the engineering world to help answer this. So there's a phenomenon called slipstick, which is when it's basically the noise that arises when fluid moves through a slightly irregular surface. So if we have someone with thick chondral surfaces, so the cartilage is all there, but perhaps superficial fibrillation, then often they'll get that sort of fine grating noise that you often hear on the stairs. And that's why we see it in the adolescents who really have a structurally sound knee. But it's, in my experience, it's that fine grating noise that often creates the most alarm amongst our patients. So I use the analogy with my patients. Imagine if we had a thick pile carpet, and I say, and that thick carpet's like your thick cartilage that's there. If I spill water on it and swish it around, I'll get a fine sort of grating noise. And that's akin to what is going on at the knee.
Thank you so much, Claire.
Pleasure.